Hi, this is Meenakshi Jolly. We will try and see what causes lupus. Why do some people get lupus? The simple answer is we don't know. Nobody knows. We are trying to find out why some people get lupus. There are lots of theories, lots of stories we are following, but there is no answer to that yet. Yes, it does tend to run in families. And we think that if there is a family member, a sibling, parents, somebody with autoimmune disease, then there is an increased chance of developing autoimmune diseases in other family members. And once you have one autoimmune disease, a person is also at an increased risk of developing another autoimmune disease. Think of it like the BOGO deal, buy one, get one free. No jokes. Yes, people with one autoimmune disease can frequently develop another autoimmune diseases. Like patients with lupus may have thyroid problem, which may also be an autoimmune disease. So we think that there is some genetic causes to developing lupus. There is a lot of emphasis, lot of studies ongoing to see if there are some particular genes that are associated with some people developing lupus more often than not. For example, in African Americans or Hispanics, lots of genetic studies are ongoing to assess this particular question. We think hormones may be associated with it. That is why probably women get it more than men, and probably because this happens in the age group where women's hormones are active or where they have the ability to have children, that also gives us a reason to think that female hormones may be associated with causing lupus. It possibly may also be something in the environment. Could be some infections that could cause this, but we have not identified a single infection for sure that causes this. Possibly it is multiple reasons acting together and giving lupus to people. Lupus can happen completely randomly in one person without any family history or known genetic association or infections. There is some feeling that probably people who are predisposed to develop an autoimmune disease, for example, they have a family history of an autoimmune disease, when exposed to some environmental exposure, may develop lupus. Some of the environmental exposures could be infections, could be chemicals. People have done some studies looking at hair dyes and such and have not found an association with that. Some medications can cause lupus, and some blood pressure medicines commonly are involved or associated with causing lupus. Fortunately, when it is drug induced lupus or a medication is causing lupus, stopping that medication usually resolves these symptoms. These days, there are these commonly used medicines for rheumatoid arthritis treatment called anti-TNF agents that sometimes can also induce lupus in patients. But like I already said, stopping these medications um, improves the patient's condition. Usually doctors are able to tell based on blood test whether the lupus the patient has is caused by some medications or not. Not always 100% correct answer, but usually we can tell based on blood tests if this is a side effect from some medication or not. Usually when it is a medication causing lupus, the symptoms are milder as compared to people who develop systemic lupus without medications. Stress can bring about autoimmune diseases because your immune system does undergo some change when there is stress. So that has also been implicated. Some people think that exposure to sunlight or ultraviolet rays may bring about lupus in people who are predisposed to develop lupus. But in summary, we really have not a clear answer as to why some people develop lupus.